Assalamualaikum and greetings to the lecturers and fellow friends who are watching this presentation. Thank you so much for your time. I hope everyone is doing well. Stay at home during this movement control order and please maintain high hygiene and healthcare. Alright, we are from Group 3. We will present case study 3 with the topic Influenza A. Before we move on to the topic, let me introduce my group members. KHAIRUN NISHAH binti AHMAD, SHAHIRAH binti SHAHARUN, Muhammad HANNAN Afandi bin SHOKRI, ARFAH binti OMAR, me myself, Nur EMILIA binti OMAR, Nur AMALIA binti Rauh, Vien and Chan SUAT MING. Now let's take a look at the scenario given. The following is adapted from a press statement by the Health Director General of Ministry of Health, Malaysia on December 31st, 2019. This is adapted from the New Straits Times. The ministry has taken cognizance of news spread in social media platforms on the increase in the number of influenza infections. He added that the Ministry of Health has been monitoring influenza cases in the country by using the proxy data recorded from the surveillance activities nationwide. Unlike temperate and cold weather countries, in tropical countries such as Malaysia, influenza infection occurrences were reported throughout the year, but within a small range. By far, all year-round influenza surveillance has not detected any out of the ordinary changes involving the nature of influenza virus. Influenza surveillance monitoring includes cases comprising influenza-like illness as well as the admission rates of patients with severe acute respiratory infection. In addition, outbreaks related to respiratory tract infections are also monitored on a daily basis. The Sungai Buloh National Public Health Laboratory and the Medical Research Institute are also responsible for monitoring any changes to the influenza virus in Malaysia. What to know about influenza? Influenza or flu is a viral infection that affects the respiratory system. Basically, there are 4 types of influenza, which are A, B, C, and D. Type A and B are widespread. Type C is milder than A and B and does not spread easily. Type D influenza mostly affects cattle and not humans. Influenza A virus can spread through tiny droplets of bodily fluid from coughing, sneezing, or talking, and someone may even catch the flu by touching their mouth or nose after coming into contact with a surface or object that has the virus on it. Since influenza A virus is highly contagious, let's take a look at the signs and symptoms of influenza A. The common signs and symptoms are sore throat, coughing, sneezing, runny nose or stuffy nose. Some may also experience headache, body pain, chills, fatigue, and fever with the temperature of 38 degrees Celsius and above.
How to distinguish influenza A with influenza like illness? Firstly, there are several types of influenza-like illness, which are the Middle East Respiratory Syndrome (MERS), Severe Acute Respiratory Syndrome (SARS), and the newest one is the coronavirus disease 19. Firstly, influenza A is caused by the automycoviridae virus, while the other 3, which are the MERS, SARS, and the COVID-19, is caused by the beta coronavirus. For influenza A, the hosts are usually from humans, swine, horses, and wild avian species. For the MERS, the hosts are usually from camels. For SARS, the hosts are usually from the cats, and finally for the COVID-19, the hosts are originally from the bats. These diseases are usually transmitted from human to human. There are also some of the diseases can transmitted from animal to human. There are several types of influenza, which are the influenza A, B, C, and D. Firstly, I will talk about the influenza A. Influenza A has 8 gene segments. It causes majority of the seasonal flu cases and causes most severe cases. It can be found in human and also animals. It can be spread from person to person. Influenza A has subtypes answering to the combination of hemagglutinin and neuraminidase. It can also mutate rapidly, and the infection is usually lasts about 1 to 2 weeks. Next, for the influenza B, it also has 8 gene segments, but it only can found in humans. It can be potentially dangerous, but is typically less severe than the influenza A. It cannot be classified into subtypes, but can be broken down into 2 lineages, which are the B Yamagata and the B Victoria. The infection also lasts about 1 to 2 weeks. Then for the influenza C, it has 7 gene segments. It contains enveloped glycoproteins, which called hemagglutinin esterase fusion (HEF). It can affect human and swine. This influenza can cause more infection than influenza type A and type B. It can be severe in infants, elderly people, and also people who have immunocompromised. Lastly, for influenza D, it also has 7 gene segments. It can be found in cattle and swine, but this influenza is not known to cause infection in humans. These are the summary of the types of influenza, which are for the influenza A, B, C, and D. For the diagnosis, specimen is collected. The specimen collected is from the throat, nasopharyngeal secretion, or sacral aspirate or washings. These are some of the figures shows how the specimen is collected. Next, for the laboratory test, it's done to differentiate the influenza that be infected. Firstly is the rapid influenza diagnostic test, RIDT. This test is less sensitivity than the RT-PCR. Secondly is the virus isolation and identification. Third, reverse transcriptive polymerase chain reaction, RT-PCR. And lastly is the real-time polymerase chain reaction, RT-PCR.
Let's move on to the pathogenesis. As you all can see, this is the epithelial cells of the alveoli. This is the influenza A virus, where the source is from the respiratory secretions of the infected individual to a healthy individual through aerosol transmissions or direct contact to a contaminated surface. So the influenza A virus will start to adhere to the epithelial cells of the alveoli. Hemagglutinin, which is the glycoprotein of the influenza A virus, will bind to the sialic acid receptor on the epithelial cell surface through the alpha-2,6 linkage in order to release the virus into the cell through endocytosis in the form of vesicle, which is known as the endosome. In the endosome, acidification will start to occur where there is the fusion of the hemagglutinin of the virus together with the endosomal membrane, which will then lead to the stimulation of the M2 ion channel, where the proton will start to influx into the viral core, and the RNP, which is the ribonucleoprotein core, will start to dissociate. So after the dissociation of the RNP, the virus will start to uncoat, and the genome is then released and transported to the nucleus of the alveoli, and where the viral replication start to occur. So as you all know, influenza A virus is a negative sense RNA virus. In order for the viral replications to occur, it needs to synthesize the positive sense RNA strand. So the positive sense RNA strand will serve as a template for the synthesis of a negative sense RNA strand. This will lead to the formation of the viral RNA and also the RNP, which is the ribonucleoprotein. The viral RNA will then transcribe into mRNA. mRNA will then enter the cytoplasm and translated into viral protein. Some of the mRNA will remain in the nucleus and serve as a template for the synthesis of a negative sense RNA strand for viral progeny. So the progeny RNA genome that are generated in the cytoplasm will then assemble the newly synthesized protein together with the viral surface protein. So the progeny virion was released from the plasma membrane through budding of the outer cell membrane in order to form a complete viral progeny. The neuraminidase will cleave the sialic acid residue that hold the newly formed viral progeny to the cell surface, which will cause the release of the viral progeny and thus permitting the spread of the infection to other uninfected cells.
Influenza A will activate immune response, which causes the production of cytokines, enzymes, and cytotoxic factors, and together with the effects of virus replication, it will cause the destruction to the upper respiratory cells, leading to airway inflammation, which damages the airway epithelial and endothelial cells, causing airway hyperreactivity and narrowing, thereby causing and worsening the bronchial asthma and chronic obstructive pulmonary disease. Besides, synergistic effects of the viral replication and immune response will lead to alveolitis, which damages the alveolar epithelial and endothelial cells, causing pneumonia or acute respiratory distress syndrome.
Hi, for today I would like to emphasize about the preventive measure. So as an individual, you must take care of yourself and always practice good personal hygiene and practice good etiquette. So you must use clean tissues, avoid crowd, always wear masks, and you must always avoid sharing your personal equipment with others. Secondly, we also need to practice systemic preventive as individuals, which is we have to take yearly vaccination and always get enough rest. And lastly, if any of the symptoms are present and occur, you must get treatment quickly and you have to practice self-quarantine.
Okay, for alternative treatment, there are a few treatments that are able to against the influenza A, including antiviral treatment. This treatment have the activity against the influenza virus. There are 3 drugs that are chemically related to the antiviral medication, which known as first is the neuraminidase inhibitor. This inhibit the neuraminidase enzyme. This drug able to against both influenza A and B virus. The example of the neuraminidase inhibitor drug are oral oseltamivir phosphate, or in treat name we call it as the Tamiflu. The second is the inhizanamivir or Relenza, and third is the intravenous paramivir or Repivap. Okay, for the second drug is the drug that able to inhibit the cap-dependent endonuclease, or we call it as the cap-dependent endonuclease inhibitor. This drug interfere the viral RNA transcription and also block the RNA replication. This able to against both influenza A and B virus. The example of this drug are oral balosavir, marbrocil, or sulfloxacin drug. Okay, and then for the third drug is the endometase drug. The example of this drug is the amantadine and rimetadine drug. Okay, this drug is target M2 ion channel protein of influenza A. So this drug only against the influenza A virus, but not influenza B virus. However, in this recent past season, this virus has high resistance to the amantadine drug. Among the influenza A, H3N2 virus, among influenza A, H3N2, and also influenza A, H1N1. Therefore, these drugs are not recommended for antiviral treatment or chemophilaxis.
Next,
effective messages can be developed to create awareness among the community. In order to do this, the first thing we need to do is to find out the needs of the community. Firstly, we need to find out what is happening and also find out what the severity of the epidemic, and also what do the community need to know about the disease, such as its symptoms, the prevention, and also the treatment. Secondly, we can create preparedness messages by using a clear, concise, and also consistent messages. In the messages, we can explain about the disease, its symptoms, and also how to prevent it. And besides, it can also include a personal hygiene messages. For example, to encourage people to do frequent hand washing, and also to urge people to cover their mouth when coughing or sneezing. And finally, in the messages, we can also explain about the vaccines and also antiviral available. And the third effective messages that can be developed is by creating a message which is eye-catching, clear, and also convincing. This can be done by making the messages into a poster, flyer, also brochure. Besides, the message can also be developed into a video, or by creating a fact sheet using a question and answer format. And finally, by making a health awareness campaign. Fourthly, effective messages can be developed by showing examples. How to do that is by, for example, we can invite influencers to participate in the campaign, or also by making advertisement by famous or actors or actresses in order to grab people's attention. And finally, effective messages can also be developed by promoting the health awareness campaign. In order to promote the health awareness campaign, the best communication channels need to be used. And there is a lot of communication channels such as social media, television, web, billboards, radio, and etc. And among all those the communication channels, radio is known as the strongest channel to reach the largest number of people, as a lot of people is listening to radio. And besides, in order to promote the health awareness campaign, a special website can also be created that can be updated routinely, so people can know the updated news easily. Besides, there is also a traditional way to promote health awareness campaign by using a newspaper.
As our friends have told us, one of the ways to create effective messages among the community is through a poster. So these are the examples of posters made by our Ministry of Health to create awareness on influenza among the community. For example, this poster explains on who has the higher risk of getting influenza infection. Infographic poster can provide a lot of information, yet easy and clear to understand by the readers. This poster will then be publicized to public spaces such as hospital, public transport, and many others. To attract a wider range of readers, we can publish the poster at social media like Facebook, Twitter, and many more. When talking about the internet, is the most effective platform to deliver messages. Hence, which is why our Ministry of Health has created a website. This website contains a lot of information to answer any question regarding the influenza. Lastly, one way to create awareness is by organizing a health awareness campaign. Campaign could be an effective way to deliver messages as it interacts with the audience directly. We can also invite public figures to attract more audience. For example, Tun Dr. Siti Hasmah had officiated a health awareness campaign on influenza organized by certain NGOs. Hence, this campaign will give more positive impact and influence on audience compared to an ordinary campaign.